I was 13, my mom was diagnosed with an acoustic neuroma. I had no idea what this meant. It could have been anything, but I knew it wasn't good. An acoustic neuroma is a brain tumor, and it's the type of thing that if you don't catch it and remove it quickly enough, the patient slowly becomes incapacitated and eventually dies. My mom's surgery took 12 hours, but by far, the scariest moment of her illness was the day she left the hospital to come home. Her medical team gave my family pages and pages of information that was nearly impossible to understand, much less act on. Over the following weeks, we helped her recover. She had to relearn how to walk, how to talk, and how to feed herself. Now, in my mom's case, we had moved halfway across the country so she could see the best neurosurgeons in the world and receive the best care. But even under those circumstances, the only thing I remember is feeling overwhelmed and terrified. The thing is, over time, we focused on building bigger and better hospitals, training up specialists, and thinking about how to effectively and efficiently treat. But that's not where healthcare ends. My mom's doctors had all the training in the world, but they faced limitations. They didn't have the time needed to prepare us, her family, to be caregivers at home. My family and I had all the desire to help my mom in the world, we just didn't know how. As a 13-year-old, I thought this was my story alone, but I was wrong. About 15 years after my mom's surgery, I found myself in a hospital in India, and this is what I saw: crowds. I learned that in India, it's very common for families to move to the hospital and live there while their loved ones receive care. And outside of visiting hours, they're left to do this: wait and pray. On the other side of the wall, I met patients like Anoop. I sat with his mom and dad when it was time for them to return home. A nurse came in and gave his family a very rushed 5-minute lecture on everything they needed to know to keep their baby healthy and safe. Changes to his diet, medications he'd have to take, warning signs to look out for, all of this and more in only 5 minutes. Like many families in India, Anoop's mom and dad lived hundreds of miles from the nearest hospital. They couldn't read or write, and they left overwhelmed and terrified. I saw this same story repeat itself over and over again, and I realized that even though I was thousands of miles away from home, the fear the families felt, I understood it because I had been there too. I also learned that very often what happens to a patient is that they'll end up getting worse after they go home, they'll have to come back to the hospital, or they'll suffer from complications that are potentially fatal and that could have easily been prevented. On that first trip, I was here as a graduate student and from Stanford, and my co-founders and I found ourselves wondering why. Why do we push eager people out of the system, and then only a few days later, we expect those same people to provide care at home? Why can't we take this motivated, capable, untapped resource, the family, and teach them how to provide care? What would happen if we turned busy hallways into classrooms and took people from the waiting room to the bedside so they could be next to the person that they love? When it comes to innovating in healthcare, we tend to think about the latest and greatest new technology or advancement to treat a specific problem. Rarely do we take a step back to look at the entire system and reimagine it. This means that sometimes we overlook or we just can't see a problem that has been right in front of us the entire time, just waiting to be unleashed. In this case, a problem, a solution that is devastatingly simple. It turns out there are a handful of things that someone needs to know to keep a patient healthy after they receive treatment. And we found there are things that we can teach anyone, regardless of literacy, if done in the right way and with the right tools. These are things like how to keep a wound and the environment around it clean, or how to recognize and react in the event of an emergency. There are things that the family is more than capable of doing, and we've found they're eager to do. The problem is that rushed moment when a patient is leaving the hospital to go home doesn't go very well. It tends to be full of medical jargon, and so what ends up happening is people just don't remember everything that they've been told. In fact, research has shown us that people immediately forget 40 to 80% of what a doctor tells them. And then, of what's left, you only remember half correctly. So just telling someone something isn't good enough. People have to be told in the right way and with the right tools. So we developed a system. We train families while they're in the hospital, and we integrate them into the way care is provided in hospitals. We start off by training nurses, and those nurses run sessions with the families in the wards. They do it before or after visiting hours, and they focus on training the families in the skills that are going to keep people out of the hospital. We found very early on that people like to be entertained, so we developed over-the-top Bollywood-style videos. We're in India, after all. And then we get families practicing the skills. So instead of 5 minutes of someone telling you what to do, you get hours to practice before you go home. And that is how we get the behaviors to stick. Care is being delivered like this in 25 hospitals across India. And so far, we've reached 70,000 families. Thank you. These are families like Aditi's. Her husband had a surgery, and she went through the training, and a few months later, we visited her in her village. She shared with us that the training not only helped her, it gave her the courage to provide for her husband, but she also taught other people in her community and in her home the skills. She wanted to make sure this didn't happen to anyone else that she loved. Our research is showing that anxiety for the caregiver is coming down by 85%. And every person we train goes on to train between 1 and 3 additional people in their community or their home. Thank you. So we were happy with these results, but we didn't expect this. We worked with a group of researchers at Stanford, and this body of research revealed that we're reducing post-surgical complications by 71%. 71%. These are serious complications. They're things like respiratory infections, wound infections. They're complications that send someone back to the hospital or in extreme cases result in death. So it works. Bringing families to the center, formally integrating them into the way care is provided can radically transform healthcare. It can save lives. We're on track to train 1 million people by the end of 2018, but that's nothing. We're only scratching the surface. Chances are you or someone you love is going through this right now. So my colleagues and I are constantly asking ourselves, how can we make this spread? How can we make this the new normal? This is a simple solution to a large problem, and better yet, it's something others can replicate. And that's the point. We have the opportunity to transform healthcare from a cold and scary experience into something that's full of compassion and love. And we can do that by bringing families to the center of care. My request to you is to think about the possibilities when you or I, people without medical degrees, work alongside doctors and nurses. Because one day, I think we're going to look back. We'll scratch our heads a little and we'll wonder, why not sooner? Thank you. Thanks.